Good afternoon. We have questions on health and wellbeing. Question number 1, Paul Martin, has not been lodged, but I have an explanation. Question number 2, Jim Meady.
Thank you, Presiding Officer. To ask the Scottish Government what action it will take to provide care and support for people with bronchiectasis.
Minister Michael Matheson.
All NHS boards in Scotland have local respiratory managed clinical networks which aim to deliver and improve respiratory services for people with all respiratory conditions. Patients with respiratory conditions sit on these networks to help ensure their voice is heard and services are developed in a person-centred way. In addition, our National Advisory Group on Respiratory Conditions is working to develop a coordinated approach to improving respiratory services across Scotland and provide the opportunity for local managed clinical networks, patient representatives and other stakeholders to discuss issues, identify solutions and to share best practice.
Jim Meady.
I thank the Minister for that answer. Does the Minister agree with me that people with bronchiectasis, and especially people who have clinically significant bronchiectasis, are entitled to receive high-quality care just as much as anyone else? Can I invite him to meet with me and my constituent, Robert Hunter, who is in the public gallery today, along with the clinical and patient members of the Bronchiectasis Interest Group in Lothian, to hear about their plans to develop a comprehensive, patient-friendly website which will support people with bronchiectasis in the self-management of what can be a debilitating and, in some cases, a devastating condition?
Minister.
Can I assure Mr Eadie that we are very much committed to ensuring that patients with any condition receive the highest quality of care within the NHS in Scotland, regardless of which type of condition it may be. That's set out very clearly in the Scottish Government's quality strategy, where we are focused on a person-centred, safe and effective healthcare system in Scotland. We continue to advocate the way in which we should improve respiratory services in Scotland is through the managed clinical networks, and we are aware that NHS Lothian are taking forward some work in relation to providing guidelines and a service pathway. Once this work has been completed, our plan would be for the National Advisory Group to look at these guidelines and to see in which and how they can then be dispersed across the rest of the NHS in Scotland to continue to improve overall service delivery. With regards to the member's invitation to meet with his constituent and other members of the group, I'd be more than happy to arrange a meeting with them at some point in the future.
Question number 3, Gil Patterson.
Thanks, Presiding Officer. To ask the Scottish Government how it promotes telehealth across the country.
Cabinet Secretary Alex Neil.
Presiding Officer, the Scottish Government, working in partnership with COSLA, is currently developing a national delivery plan for telehealth and telecare, and I'd be delighted to make this available to the member when it's published next month.
Gil Patterson.
Can I thank the Cabinet Secretary for that answer? Can you clarify what is being done to ensure that NHS boards adopt e-health and telehealth systems for both cost and clinical benefit?
Cabinet Secretary.
Presiding Officer, the e-health strategy for 2011-17 sets out the key e-health deliverables that NHS boards will take forward over the lifetime of the strategy. The strategy has 6 strategic aims. 4 of these are concerned with different clinical benefits, and one deals specifically with realising efficiencies and savings. The Scottish Government currently provides funding of £17 million per annum to deliver these strategic aims. Activity on e-health is integrated with each health board's planning and delivery cycle, and all local and national e-health investment is subject to regular monitoring.
Thank you, Presiding Officer. On a related issue, can I ask the Cabinet Secretary what progress has been made in expanding the use of the Internet to improve contact with GP surgeries in areas such as making appointments, access to repeat prescriptions, health records and test results?
It's just related, Cabinet Secretary.
Yeah, I'm quite happy to answer it, Presiding Officer, and particularly covering the Grampian area, which is probably the furthest ahead in telehealth in terms of the NHS in Scotland. And we are very keen and very much working towards the kind of connectivity between GPs and their patients that the member refers to. I don't see this as purely a rural issue. I think the person living at the top of a multi-storey in Glasgow might find this as a useful tool as someone living in a remote croft in the Highlands. I think it's a national strategy and it covers every aspect of the health service, primary care, acute care and allied services as well.
Question 4, Richard Lyle.
Yes, to ask the... Sorry, Presiding Officer. To ask the Scottish Government when it expects to appoint a new chair of NHS Lanarkshire.
Cabinet Secretary Alex Neil.
The Presiding Officer, interviews for the chair appointment to NHS Lanarkshire took place on due to take place on the 19th of November. It's hoped that the successful applicant will take up their appointment sometime in early December.
Richard Lyle.
Firstly, can I thank NHS Lanarkshire for providing my successful eye operation last Sunday. I now can see the clock in this chamber. Does the Cabinet Secretary agree that the appointment of a new Chief Executive of NHS Lanarkshire is urgent, and could he possibly share with this chamber his thoughts in making the appointment before the end of the year, as I understand that the application date is now closed?
Cabinet Secretary.
Presiding Officer, I won't say that Mr Lyle and I see eye to eye on this issue. No, we didn't. The Chief Executive post is a key post for every NHS board, and I understand that NHS Lanarkshire intends to complete the selection process for the post in Lanarkshire across 2 days, the 6th and 7th of December. Clearly, I would want the new chairperson to be involved in that appointment before it is confirmed. The Board Remuneration Committee will conduct the interviews with the Director General for Health and Social Care acting as the external member. If the selection process identifies a suitable candidate for appointment, it would be hoped that that person would be in the position as soon as possible thereafter.
Yvonne McMahon.
Thank you. While we await the appointment of the new chair, the Cabinet Secretary has recently intervened regarding the provision of mental health services within NHS Lanarkshire. Does the Cabinet Secretary intend to intervene in reviews of acute services in all areas, prior to those reviews being considered by the relevant health board, and of course before crucial appointments are made?
Cabinet Secretary.
Presiding Officer, there is an issue around the future of mental health services in Monklands Hospital. Because it lies in my constituency, that matter is being dealt with by my ministerial colleague, Michael Matheson.
Question number 5, Annabel Goldie.
To ask the Scottish Executive if it is satisfied with the choice of drugs available to cancer patients.
Cabinet Secretary.
Presiding Officer, as Ms Goldie will be aware, the Scottish Medicines Consortium independently appraises newly licensed medicines to treat all conditions, including cancer, and provides advice to NHS boards on their clinical and cost effectiveness. The Scottish Medicines Consortium is globally respected with robust appraisal arrangements and the fastest and most efficient medicine review process anywhere in the UK. I want to ensure that Scotland remains at the forefront, so I've asked Professor Philip Routledge, Professor of Clinical Pharmacology at Cardiff University, to review current drug appraisal practices of the Scottish Medicines Consortium to consider if there is scope for further improvement. In parallel to this, I've asked Professor Bill Scott, the Scottish Government's own Chief Pharmacist, to assess how the Scottish Medicines Consortium's decisions are implemented by NHS boards to ensure there is a consistent and effective approach to prescribing policies across the country, including through individual patient treatment requests.
Annabel Goldie.
I thank the Cabinet Secretary for that response. As he may be aware, earlier this month there was approved for use in England the skin cancer drugs Zelbarath and Yervoy. And to skin cancer patients in Scotland, that it's not available to them is not only distressing but incomprehensible. Will the Cabinet Secretary ask Professor Routledge and Professor Bill Scott to consider how greater flexibility might be introduced into the system to avoid these anomalies occurring? It's not just a question of across Scotland, but cross-border.
Cabinet Secretary.
Presiding Officer, can I say we could go through a list of drugs for a whole range of conditions, some of which are available in England that are not available in Scotland, some of which are available in Scotland that are not available in England. I think the important point is that we have a robust procedure independent of politicians who are not qualified to decide either on the medical or the cost effectiveness of any particular drug. I believe we have a very robust system. However, I believe it's right that we look at how we can further improve it. And I particularly am keen to move from a situation where we have 14 separate criteria, one for each board, in terms of prescribing those drugs approved by the SMC, and also one protocol instead of 14 in in relation to individual patient requests. These are the issues Professor Routledge and Professor Scott will be examining on my behalf and will come forward with recommendations in the early part of 2013.
Christine Graham.
Thank you, Presiding Officer. Cabinet Secretary will have received a letter from me regarding a constituent who is paying privately for cetuximab. That said, he and his wife fully appreciate the role of the SMC, though I'm glad to see that there's some review going on. However, in the meantime, there is the issue of administrative charges plus VAT with regard to the invoice he has received for this private treatment. Is there any way that these two charges can be dealt with?
Cabinet Secretary.
Presiding Officer, I wouldn't want to discuss the individual merits or demerits of an individual case in the Chamber. The member has written to me and I'll give due consideration to the point she raises.
Richard Simpson.
Thank you, Presiding Officer. Can I, first of all, welcome the announcement, which is indeed very welcome. Can I welcome it on behalf of the Labour Party? It's something that we look for, particularly the 14 different area drug and therapeutic committees, which I've been banging on about for some time, shall we say. But can I ask him, the Cabinet Secretary, whether he believes it can be justified that a patient who applies for medical treatment under the individual patient treatment request system has their waiting time clock reset to 0, that's under the target system, rather than stopped?
Cabinet Secretary.
If the member sends me details of where this has happened, I'm happy to investigate and consider the matter.
Neil Findlay.
One of the options available to cancer patients, especially those in the latter stages of their illness, is homeopathic drugs and medicine. Can I ask the Cabinet Secretary if he shares my concern at the proposals by NHS Lothian to close the homeopathic clinic at St John's and indeed homeopathic services across the Lothians? Because if it does, it will certainly impact on patient choice, especially for those with cancer.
Presiding Officer,
Cabinet Secretary, it was widely marked, but if you want to take that on.
I have a very detailed response that I can give because I was anticipating the question from Mr Finlay, but since it's slightly out of order, I'm happy to write to Mr Finlay with a detailed explanation of the current status.
Point order, Mr Finlay.
The question was about cancer drugs. Homeopathic medicine can be part of cancer treatment. I fail to understand why that question is out of order.
It's out of order, Mr Finlay, because I said it was out of order. We're talking about drugs for cancer patients. Jamidi.
Cabinet Secretary for recognising the concern of patients across Scotland about the equity of access to new treatments. And can I urge him to ensure that the need to provide patients with new innovative treatments should be at the heart of this review, as well as tackling the barriers to access through the area drug and therapeutic committees and through the individual patient treatment request process. Because it's very important that we recognise that while cancer medicines and medicines for orphan conditions and ultra-orphan conditions can be high cost, they are often low budget across the whole of the population.
Cabinet Secretary.
I say, Presiding Officer, I think Mr Eadie raises a very, very valid point, and very specifically, Michael Matheson and I have included in the remit the very point that Mr Eadie makes, because there are some drugs which, looked at only on a very narrow accountancy basis, look as though they're very expensive drugs. However, if they then result in many more substantial savings, particularly in hospitalisation, for example, the overall saving to the National Health Service makes the drug worthwhile prescribing. And that is one of the areas that we want to make sure is going to happen in future, that a broad view is taken of the costs and benefits of individual drugs, rather than just a narrow view on the cost effectiveness in a very accountancy-based way of any particular new drug.
Question number 6, Lee MacArthur.
Thank you. To ask the Scottish Government what discussions it has had with the Scottish Ambulance Service regarding the adequacy of emergency response cover on the smaller Orkney Isles.
Cabinet Secretary.
Presiding Officer, the Scottish Government is in regular contact with the Scottish Ambulance Service on a range of issues, including the emergency response cover provided to our island communities. As conveyed by the member by my predecessor back in May, the Government are actively supporting the development of service models to support these very communities through dedicated project management support this year. I believe that people who live in the most remote areas of Scotland have a right, the same as the rest of us, to high-quality health services, but the way in which these can be delivered will differ from areas of urban Scotland, or indeed mainland Scotland. I expect the Scottish Ambulance Service to continue to work with NHS boards, local authorities and other partners to develop innovative service models that best support patients. That must, of course, be within a framework that assures clinical governance and patient safety.
Neil MacArthur.
Can I thank the Cabinet Secretary for that very comprehensive response? And notwithstanding what he said, can I make him aware of concerns that have been raised with me by community leaders in the islands of Shetlandsea and North Romsey recently about ongoing inadequacies in emergency medical cover? Now, I've raised these with Scottish Ambulance Service and NHS Orkney and understand that meetings are taking place. And while the circumstances differ in both islands, I think they both point to ongoing problems with the overall service. So can I ask the Cabinet Secretary to use his influence to ensure that these concerns that have been raised are addressed so that my constituents living in the smaller islands in Orkney get the service they deserve? Thank you.
Cabinet Secretary.
Presiding Officer, I'm more than happy to use what influence I have in these matters. I think it's extremely important that particularly remote island communities, but island communities generally, and indeed rural communities generally, have equality of access to all aspects of the National Health Service. And meetings are taking place, as the member referred to. I hope those meetings will lead to a satisfactory conclusion, but if they do not, and if the member wants to raise any future issues with me on this, I will take them very seriously and very proactively pursue a resolution to these issues.
Question number 8, Jackie Bailey.
To ask the Scottish Government how many transcatheter aortic valve implementation procedures have been performed in Scotland since the Cabinet Secretary for Health and Wellbeing announced that these would be made routinely available.
Cabinet Secretary.
Presiding Officer, there have been 4 transcatheter aortic valve implantations or TAVI procedures performed in Scotland to date. I have to say TAVI is a lot easier to say.
Jackie Bailey.
I wholeheartedly agree with the Cabinet Secretary and welcome his announcement that TAVI would be routinely available in Scotland. And at that point, there were almost 100 patients, as I understand it, waiting for treatment. Can he tell me whether referral direct from the patient's cardiac consultant to Edinburgh is how the system works? And can he also advise me whether there is any delay or any barrier to patients receiving treatment, given that only 4 have received treatment so far?
Presiding Officer, the treatments have only really just begun, so it's very early days. I would anticipate those numbers increasing fairly quickly in the immediate period ahead. However, I should make it absolutely clear that I'm keeping a very close monitor on the numbers, because if they do rise, for example, in line with what are hypothetical analyses from south of the border, if that's extrapolated into Scotland, then there may well be a need fairly soon to make TAVI available elsewhere other than and in addition to Edinburgh.
Jackson Carlow.
While we're on matters aortic, Presiding Officer, can the Cabinet Secretary confirm if screening for abdominal aortic aneurysms in men over 65 is now being offered by all health boards in accordance with the Government's policy and timetable?
Cabinet Secretary, that's wide of the mark. Question number 9, Marco Biaggi.
Ask the Scottish Government how many people with long-term health conditions who formerly did not receive free prescriptions now do so.
Minister Michael Matheson.
It's difficult to estimate the number of long-term health conditions or people with long-term health conditions who did not qualify for free prescriptions before charges were abolished in 2011, as we do not have a conclusive list of those long-term conditions. Before announcing in 2007 our intention to phase out prescription charges, we looked at extending the list of long-term conditions which would entitle people to free prescriptions. The long-term conditions which were not included in that list of statutory medical exemptions included cancer, rheumatoid arthritis, Parkinson's disease, multiple sclerosis, asthma, HIV, and the list goes on and on. Indeed, the list goes on so far that the Scottish Government concluded that, given the time it would take to deal with this issue and the difficulties which would arise from it, the fairest solution was to abolish prescription charges completely.
I thank the Minister for that answer, and clearly what he is referring to is still the situation in certain other jurisdictions within these islands. Does the Minister agree with me that such an exercise that attempts to decide which long-term health conditions are worthy and unworthy would be doomed to failure, and that instead of insultingly dividing up those receiving medicines into the deserving and undeserving ill, it is vital that we remain true to the founding principles of the NHS and continue to offer free prescriptions to all?
Yes, I very much agree with the member. I remember, if I recall at the time, representation from the medical profession was concerned around trying to provide a list of long-term conditions would actually prove to be very, very difficult, and we could have a situation where an individual could have 3 or 4 conditions. For 2 of them, the free prescription would apply, and for 2 others, it may not apply. And also, it would have to be continually updated. What I can say to the member in terms of the numbers who have benefited from it, within the constituency of Edinburgh Central, since we have abolished prescription charges, over 8,000 of his constituents have benefited from that policy directly.
Richard Simpson.
Can I say that I understand the Minister's problems with extending disease conditions, but of course the system was that if you had a condition like diabetes, you were exempt from all prescriptions. So can I ask him, however, whether he plans to abolish the means testing and the disease-specific inclusions and exclusions to which he's referred in the terms he's referred it to? Is he going to abolish the means testing for the minor ailment scheme? Because the previous system of inclusions and exclusions still applies to the minor ailment scheme. And of course, universal benefits do not apply either to dental charges or optical charges. So will they continue with means testing in these illness areas that some people are treated differently?
Minister. As I said in this chamber yesterday afternoon to Mr Simpson and his colleagues, we as a government remain committed to the position of free prescriptions. I would remind Mr Simpson that he was elected just last year on a manifesto which I quote, and that is, Scottish Labour remain committed to no reintroduction of prescription charges. We as a government will remain committed to our promise in the manifesto last year, and that is to make sure that people get their prescriptions free of charge.
Question number 10, Murdo Fraser.
Health inequalities between manual and non-manual workers.
Minister Michael Matheson.
Tackling inequalities in health is one of the Scottish Government's top priorities. We recognise that work is one of the key social determinants of health, and that one of the best ways of reducing inequalities in health in Scotland is to make sure that as many people who we can, who are in work, get an opportunity to do so. We support the Scottish Centre for Healthy Working Lives through NHS Health Scotland to offer advice to employers on improving and promoting the health and well-being of their employees. Working in partnership with organisations such as the Scottish Chambers of Commerce and the Federation of Small Businesses in Scotland, the Centre specifically targets small and medium-sized enterprises where there are high levels of low-paid workers who are most vulnerable to inequalities in health.
Fraser.
Can I thank the Minister for his very comprehensive reply. He will be aware that the recent figures showed that the health divide between manual and non-manual workers in Scotland is amongst the worst in Europe. What is the Scottish Government doing to support initiatives such as the British Heart Foundation's Hearty Lives programme, which are aimed at targeting health advice and assistance from those from less well-off backgrounds?
Minister.
I think the member raises a very important point, and the campaign which has been run by the British Heart Foundation is one which I think can have real value in helping to try and close down some of these health inequalities which we face in Scotland. I think in the member's question, though, he would also recognise that some of those health inequalities we have in Scotland have been there for many decades and will probably take many decades in order to address effectively. What we have in place is a range of measures to try and make sure we do that as effectively as possible, doing so in partnership with the NHS and with the third sector and independent sector where they can play a part as well. What I would caution the member on is that some of these health inequalities are in danger of being exacerbated by some of the changes in the welfare reform programme that's been taken forward by the UK Government, which has the danger of actually underdoing some of the good work that's been taken forward in closing down these health inequalities over recent years.
Question number 11, Roderick Campbell.
To ask the Scottish Government how it ensures that families and carers are involved in the policy development and service delivery of mental health services.
Minister.
In the recently published mental health strategy, we identified working with families and carers as one of the key themes which emerged from the consultation. Families and carers' involvement is important in providing safe and effective care and treatment. It's also vital that service providers involve service users, families and carers as an integrated part of the service design. We have developed this in two ways. Firstly, we are working with NHS Education Scotland to work with clinicians to develop clinical confidence in involving families and carers while maintaining the principle of patient confidentiality. We are also working with Vox, which is Voices of Experience, to engage service users in exploring how families and carers can be involved in care and treatment, while recognising that some people do not want their family to be involved.
Roderick Campbell.
I thank the Minister for his answer, but does the Minister agree that one way forward is to work with service users, their families and carers to develop home treatment centres such as crisis houses to offer support to help resolve a severe mental health crisis in a residential rather than hospital setting, a service which is as yet unavailable in NHS Fife?
Minister.
I think the member has raised a very important point, because an area where I think we need to make much further progress in the way in which we deliver mental health services in Scotland is to be much more responsive to those individuals who present themselves as being in crisis or in distress. Some of the work which we are taking forward in the NHS Tayside area is intended to look at how we can make sure agencies are much better coordinated in responding to individuals who present in those circumstances, and to make sure that when they do respond to them, that they follow that up appropriately to give the individual the greatest opportunity to take benefit from the services which they offer. Crisis houses are one of the approaches which I think could lend itself to addressing this particular issue, and it's one of the key areas which has been highlighted in the mental health strategy as an area where I wish to see further progress being made.
Question number 12, Christina McKelvey.
Thank you, Presiding Officer. To ask the Scottish Government when it will next meet NHS Lanarkshire and what will be discussed.
Cabinet Secretary.
Presiding Officer, I will meet with NHS Lanarkshire in a ministerial capacity on the 14th of January 2013 at the next meeting of NHS Chairs, when we will discuss matters of importance to the people of Lanarkshire.
Christina McKelvey.
Could I ask the Cabinet Secretary at that meeting to raise with NHS Lanarkshire, I know he will be aware that NHS Lanarkshire has recently signed a contract with ATOS to deliver the Personal Independence Payments Assessment for sick and disabled people on benefits without actually seeing the contract first. I find this deeply disturbing given the reported actions of ATOS and how they carry out the work they do. Can he assure me that in the light of the Westminster inquiry into ATOS and their very questionable assessment practices that constituents like Larkhall man Brian McArdle was subjected to, which his family believe linked to his death, that the Cabinet Secretary will monitor very closely any public body contracted with ATOS, especially when the terms of the contract was not known at the time of signing?
Cabinet Secretary.
Presiding Officer, can I make 3 points in reply? First of all, I will be monitoring this situation very closely indeed. And I want to do two things in particular. Number one, I want to be absolutely sure that this contract does not in any way damage the reputation of the National Health Service in Scotland. Secondly, I want to ensure that no resources of the National Health Service will be diverted into this activity. Thirdly, in relation to the contract, I am advised by NHS Lanarkshire that it is not normal practice for full contracts to be circulated to NHS board members. However, any board member can request a copy of the full contract. What is important is that board members are in receipt of the pertinent facts in order that they come to an informed decision. I'm beginning a round, Presiding Officer, of bilateral meetings with the non-executive directors of our health boards, and when I have the meeting with the non-executive directors of the Lanarkshire Health Board, I will want to assure myself that any contractual procedures within that health board, and similarly with all the other health boards, are sufficiently robust.
Jackie Bailey.
Thank you very much, Presiding Officer. Can I just tease that out? Is that common or good practice for the terms of a contract for an agency directly of the NHS, to not be known before it is signed?
Cabinet Secretary.
Presiding Officer, it's been standard practice indeed if the NHS board saw the terms of the PFI contracts that were signed in Lanarkshire, I would hope they would never have been signed because they're now costing NHS Lanarkshire £45 million a year.
Jackson Carlo.
In his conversations with NHS Lanarkshire, will the Cabinet Secretary, on behalf of men aged 65, establish whether abdominal aortic aneurysm screening is now being offered routinely in accordance with the Government's policy and timetable?
That was a clever question you should have had some time ago, Mr Carlo. Cabinet Secretary.
I think it's only fair that Mr Jackson declares an interest in the question, given the age range he's discussing. Anyway, I am more than happy to double-check the situation and write to Mr Carlo as quickly as I possibly can to put his mind at rest, Presiding Officer.
Margaret McCulloch.
With performance against the 4-hour waiting time standard in A&E down on August of this year across Lanarkshire and continuing to worsen, and 8 and 12-hour waits still a persistent problem, will the Cabinet Secretary make sure that he raises the issue with NHS Lanarkshire and he looks again at the staffing situation and provision of minor injury services?
Cabinet Secretary.
Presiding Officer, we are actually in constant contact with NHS Lanarkshire on this very specific point and working with them to ensure that targets are met in future. I have been reassured both by NHS Lanarkshire and my own department, having looked at it, that any problem in terms of meeting that target is not related in any way to any staff shortages. I should point out, however, that had the plans of the Scottish Executive gone ahead under the Labour and Liberal Democrats to close the Accident and Emergency Department in Monklands, the situation would have been much, much worse than it is at the present time.
Question number 13, Annabel Ewing.
Thank you, Presiding Officer. To ask the Scottish Government what research has been conducted on the health benefits of vitamin D.
Minister.
The Scientific Advisory Committee on Nutrition is in the process of reviewing all relevant scientific literature on vitamin D as part of its review of the current vitamin D recommendations. The review will consider a wide range of health outcomes associated with vitamin D status, and its findings will be published in late 2014.
Annabel Ewing.
I thank the Minister for his answer and look forward to the outcome of that review, but taking into account also the potential role for vitamin D in gaining a better understanding of multiple sclerosis and its particularly high incidence in Scotland, can the Minister undertake to explore whether there may be any European funding available to underpin much needed further research?
Minister.
I am aware that there's research linking vitamin D to a number of illnesses, including multiple sclerosis. As part of the review, my understanding is that the Scientific Advisory Committee on Nutrition is examining all current, available and emerging research linking vitamin D to multiple sclerosis. A key part of the review will be to identify whether there are any gaps in this research, and if so, what further research may then be required. Once the review has been completed, I can give the member assurance that we will consider how best to take forward any recommendations that may be contained within the review and whether there's any further need for further research in the area of MS in this area as well, Presiding Officer.
Question 14, John Scott.
Thank you, Presiding Officer. To ask the Scottish Government what recent discussions it has had with NHS Ayrshire and Arran regarding patient care.
Cabinet Secretary.
Presiding Officer, Ministers and Scottish Government officials regularly discuss matters of local importance such as patient care with all NHS boards, including NHS Ayrshire and Arran.
John Scott.
I thank the Cabinet Secretary for his full answer. And the Cabinet Secretary is aware of recent concerns about the number of cancelled appointments, of concerns about the dissemination of information to staff following critical incidents, and of concerns about the bedding in of the patient management system in NHS Ayrshire and Arran. Can he tell Parliament if these matters have all now been resolved to his satisfaction?
Cabinet Secretary.
Presiding Officer, one of the first meetings I requested when I was appointed to the post of Cabinet Secretary was with the Chief Executive of Ayrshire and Arran to discuss most of the issues raised by Mr Scott in a very reasonable fashion. And I have made it absolutely clear to the Chief Executive, and I will repeat it when I do the NHS Ayrshire and Arden Board review in early December, that I expect a reasonable resolution to all of these issues. I have, of course, received additional representations, and I believe some of these matters may feature in the forthcoming Panorama programme. If any new information comes forward, I will also want to ensure that all of these matters are properly addressed to my satisfaction and, more importantly, to the satisfaction of the patients and populace of Ayrshire and Arden.
Kenneth Gibson.
Cabinet Secretary, recently Ward 3F of the Medical High Dependency Unit at University Hospital Crosshouse won the Nursing Times Award 2012 for Emergency and Critical Care. The Orthopaedic Rapid Recovery Team at University Hospital Crosshouse won the Top Team Award at the Scottish Health Awards 2012, and the Radiographer-led Reporting Team for NHS Ayrshire and Arden won Team of the Year from the Scottish Council of the Society of Radiographers. Does the Cabinet Secretary agree with me that Ayrshire and Arden Health Board continues to carry out outstanding work on behalf of patients?
Cabinet Secretary.
Absolutely, Presiding Officer. We should always get into context where there are problems. The excellent work that is going on, and I myself presented the awards at the Scottish Health Awards ceremony this year, and I was delighted to do so with to celebrate the tremendous work that is going on, not just throughout the Ayrshire and Arden area, but indeed throughout the National Health Service in Scotland. I visited this morning the new laboratory at Glasgow Southern General Hospital, which again is going to be an exemplar of excellence, not just in the National Health Service in Scotland. It is now one of the leading-edge laboratories in the whole of Europe.
Question number 16, Liz Smith.
To ask the Scottish Executive what recent assessment it has made of the impact of the closure of rural GP surgeries.
Cabinet Secretary.
Presiding Officer, NHS boards have a statutory obligation and are accountable for those services which they consider necessary to meet all reasonable requirements for their areas. I am particularly aware of the issues concerning the remote and rural areas of Scotland, and my officials are in regular contact with members of the DURE Committee, amongst others. That's why I have recently endorsed a proposal for a specific programme of work to be taken forward by NHS Highland to develop and test a model or models for the delivery of care in the remote areas of Scotland.
Liz Smith.
I thank the Cabinet Secretary for that reply, and interesting about the pilot in Highland. Would it be the Scottish Government's expectation that more needs to be done, not only to make sure that there is good cover, but to publicise those GP surgeries which are working and open and the hours that they are working?
Cabinet Secretary.
Well, I would hope much of that is being done already in every area, Presiding Officer, but where it's not being done, and if members want to draw it to my attention, I will certainly exert what influence I have to make sure that it is done. There is undoubtedly a major problem in parts of rural Scotland in particular in terms of recruiting both GPs and consultants to the acute sector, and I'm actively looking at how we can do more to ensure that these vacancies are filled and filled timely.
Question 17, Grace Crawford.
Thank you, Presiding Officer. To ask the Scottish Government what discussions it's had with NHS Forth Valley regarding waiting times for IVF treatment.
Minister.
The issue of long waiting times for IVF treatment was specifically raised at NHS Forth Valley's annual review in 2011. Since then, the Board has committed to funding an additional 28 cycles on an ongoing basis, and waiting times have reduced from 4 to 3 years. As the member will be aware, the Scottish Government has committed not only to a 12-month waiting time for IVF, but we have also committed £12 million over 3 years to support this and ensure, for the first time ever in Scotland, a maximum wait of 12 months by the 31st of March 2015, regardless of where an eligible patient lives. The Scottish Government has been involved in ongoing dialogue with all NHS boards in respect of the provision of IVF treatment over the past 12 months. All NHS boards will be asked to produce a robust implementation plan detailing how they will reach the 12-month waiting time.
Ms Crawford.
I thank the Minister for his answer. I have constituents in the Forth Valley Health Board area who have been trying to conceive their first child for 3 years. They were recently being referred for IVF treatment to Dundee and were told the waiting list was 4 years. They've also been told, and perhaps erroneously, and perhaps and given in light of what the Minister has told me, that if the first cycle of the IVF treatment is unsuccessful, the return to the end of the waiting list mean that some couples could meet wait up to 8 years for a second treatment. Could the Minister please tell me what advice I should give in these circumstances to my constituents to aid them in securing earlier IVF treatment?
Minister.
Presiding Officer, the practice of NHS boards across Scotland is for couples with unexplained infertility to try to conceive naturally for 3 years before being referred for IVF, although couples will receive some investigations during that period. This is for clinical reasons, as couples with unexplained infertility are generally more likely to conceive naturally in the first 2 to 3 years of trying to conceive than with IVF. The National Fertility Group, though, are reviewing this particular criteria. Returning patients to the bottom of the waiting list for a second fresh cycle of IVF treatment when waiting times are very long is not acceptable. As I have just set out, funding from the Scottish Government will, over the next 2 years, reduce waiting times across Scotland to 12 months and will ensure that patients do not have to have unacceptable long waits for cycles of IVF. NHS Forth Valley have been making progress, and I would expect them to make further progress, and by early next year I would expect the waiting list to be down from 3 years to 2 years.
That ends portfolio questions. The next item of business is a debate